And now, you're listening to the Mad Dad Podcast with your host, Gabe Gonzalez.
Hey everyone, today millions of Americans and people all over the world are waking up to the same nonsensical news and media that floods their social circles and media outlets every day. It's time to flip the script and embrace the truth, freedom, and faith-based value. That's what this podcast is all about. We're here to offer you truth and motivation. I'm your host, Gabe, and you're listening to the Mad Dad Podcast. Let's get mad. Let's get motivated. Hey everybody, this is Gabe, and today is Mad Dad Monday. Let's go. Happy Monday, everybody. I want to thank you so much for tuning in to the Mad Dad Podcast. We want to thank you for your support of the Mad Dad Podcast, and we want to invite you to hit that like button. Like, subscribe, and join the tribe. Be part of the Mad Dad tribe. Be part of our followers, and stay connected with us. Leave us a comment. Let us know how we're doing on these podcasts, so that way we can continue to improve. If you want to stay connected with us daily, I want to invite you to follow us on Instagram at Mad Dad Podcast. That's where we stay engaged with our followers every single day and help us reach that goal. We're trying to get to 1,000 subscribers or followers on Instagram. Go to Instagram today, hit the like button, and invite a few friends to follow us as well. It would really help us out. Of course, before we get into today's episode, I want to remind you that we are doing a Mad Dad raffle for the month of January. We're going to be giving away a brand new pair of second-gen AirPod Pros. That's right, brand new pair of Apple AirPod Pros. You want to get in on this raffle. All you have to do to enter is go to our website, maddadpodcast.com, and enter to win $10. Give us a $10 donation. That's all we're asking for. $10 will get you 5 entries into the raffle. If you want to get a higher chance of winning one of these pair of AirPods, you can purchase merch from our merch shop. Today I'm sporting one of our new Mad Dad shirts. Says get mad, get motivated. Got the American flag and Mad Dad Podcast on the right sleeve. This is a great shirt to wear around town. It's a great shirt to wear in the gym. If you follow us on Instagram, you've seen me lately sporting some of our shirts at the gym. And I'm going to tell you, people stop and ask questions when they see the shirt. Hey, what is this about? What's Mad Dad Podcast? I want to invite you to represent the Mad Dad Podcast. Go on our website today, get some merch, and get 30 to 50 entries into this raffle. The more entries that you get, the higher your chances are of winning a brand new pair of AirPod Pros. Go to our website, maddadpodcast.com, to enter the raffle today. Let's jump into our episode. I have some exciting things I want to share with you today and some thoughts for you. All right, so in my opening thoughts for today, I want to talk to you about this new law that was passed here in the state of California and went into effect on January 1st. And this is regarding the topic of healthcare. Now, I know healthcare is a widely debated topic in politics. Usually the biggest debate is healthcare a right? Is it something that everyone should have the right to have access to? Or is healthcare a service? Is healthcare something that we should be charged for and that we should pay for? And that is not necessarily the point of what I'm going to talk about today, but specifically something happened here in California that is majorly going to affect healthcare in the state of California and ultimately in the United States if more states start to follow suit of California, as they usually do when it comes to these types of Democrat liberal policies. So here's what it is. As of January 1st in the state of California, Governor Newsom and his legislation, his administration, they made California to become the first state in the United States to provide free health care for undocumented immigrants. Free health care for undocumented immigrants. That means people who have come across the border illegally, not following the process of naturalization or immigration in the U.S., but people who are here and are not allowed to be here or supposed to be here. They just crossed the border and are living in the state of California. They have access to free health care here in California. Gavin Newsom said this: in California, we believe everyone, notice he uses the word everyone, deserves access to quality, affordable health care coverage, regardless of their income or immigration status. That is the statement that his office released regarding this new law that went into effect. Let me just share some information with you so you get an understanding as to what we're talking about. When we say healthcare, what we're talking about is Medi-Cal, which is government healthcare provided by the state of California to usually low-income people. And I'm going to, trust me, I know some of you are already on pins and needles when we start talking about kind of these hot topic issues, but I'm going to break this down and explain why this is a problem. Currently, right now, Medi-Cal is already serving more than 14.6 million Californians. 14.6 million Californians are on Medi-Cal. That means they're on government insurance at little to no cost to them. That's a third of the state's population. Now, by opening up Medi-Cal to undocumented immigrants, we are going to be adding roughly 764,000 more individuals to a system that is supported and that is funded by yours and mine tax-paying dollars. Okay? Let me just give you some statistics. This is not stuff that I'm making up. This is not, just my opinion. Let me give you some statistics to kind of lay the foundation so you get a picture as to what it is that we're talking about and what are the implications to these types of major changes in policy and in law in this country and in the state of California. In the year of 2023, it's estimated that over 2.5 million, not 250,000, 2.5 million illegal immigrants have crossed the southern border and entered into the United States illegally. The border crisis is that. It's a crisis, and we can do a whole podcast, probably several on that on another day, but at the bottom line is this, is that we have a major problem with an unsecure border on the southern border, and people are flooding into this country illegally. Before I get into more about healthcare, let me just say this, and this is where I stand on the topic of immigration. I am not anti-immigration. People think that all conservatives are against immigration. I'm not anti-immigration. I believe America is still the greatest country in the world to live in and offers the most to its residents, to the people who live here. It is the land of opportunity. Now, granted, those opportunities are being taken away from us more and more every day, but at the end of the day, America is the most desirable country for most people to live in, and the most opportunity to build that quote-unquote American dream. I'm not anti-immigration. I don't have a problem with people from other countries who want to come into our country and live here. What I am against is people who want to come illegally into this country, meaning that they don't go through the process of naturalization, or that they don't come here on a work visa or some type of legal way to where they are equal contributors to our society and to our financial U.S. economic system, like you and I, the people who are American citizens who go to work and contribute and support our economic system. So I'm not against people coming to this country. In fact, I have family who live in Mexico. My grandmother was an immigrant to this country, but she didn't just decide one day she woke up and she was just going to run across the border or swim across the river or hop the wall. There wasn't a wall, but what I'm saying is she didn't come by some illegal means. She came into this country legally, and she became a naturalized U.S. citizen. And while she was here, and she's still here, by the way, but in her process of immigration, she came here on a work visa. She went to college, got 2 bachelor's degrees, worked as a nurse, contributed, paid her taxes. Like, she was part of the American society. And ultimately, she became a naturalized U.S. citizen. And that's the way it's supposed to be done. The problem with illegal immigrants who are coming into this country is that because they're undocumented, they don't pay taxes, they don't contribute in any way other than taking jobs away from American citizens who are looking for work. They come into this country, they freeload, they live off of the government, they live off of all of these programs, and when they come to this country, it's costing something. And we're going to talk about that, specifically healthcare. It's costing the American taxpayer money. And so my thing is, if you want to come to America, come to America. Welcome to America. We're here. This is the land of the free. This is a place where people can come and build a future. There's people running from tyrannical governments and oppression, and I'm all for that. But do it the right way. Do it the way that it's supposed to be. So 2.5 million illegal immigrants cross into the southern border. Okay, let me just put this in perspective. Okay, 2.5 million people, that is more than the total population of the state of New Mexico. That's like another state being added to our country. In fact, that's a larger population than 16 of our 50 states. There are 16 states in the United States that have a smaller population than the total amount of illegal immigrants who have crossed the southern border just last year. That doesn't account for the last 5 years, the last 10 years. Over 500,000 illegal immigrants have crossed the California border in 2023 and have chosen to reside in California. That's a fact. Okay, 500,000 people, that's a lot of people. And look, I want to reiterate here, okay, because I know there's going to be people who watch this and are going to think that, I hate, Mexicans, that I hate immigrants, and that I'm racist. No, this is not a racial issue. I love people. I don't care what color you are. I don't care what nationality you are. I don't have a problem with immigration. I have a problem with people who come illegally into this country. So Gavin Newsom, state of California, is saying, hey, if you're an illegal, undocumented immigrant, we're going to give you, starting January 1st, 2024, free health care. Now, there's a few problems with this, and I want to break it down for you. I'm not hating on people who need help. I'm not saying that people shouldn't have access to health care. I'm not saying any of that. But there's problems with the way this is being structured, and it's affecting your life, my life, our everyday life. The first problem is this. The illusion that healthcare is free, they use this term loosely, free healthcare, is a bold-faced lie. Nothing in this world is free. Nothing. I remember when we were growing up, my dad would tell us that nothing is free. Everything costs somebody something. A recent analysis by the nonpartisan, that means not Democrat, not Republican, not a biased group here, a recent analysis by the Nonpartisan Legislative Analysis Office estimates that it will cost, listen to this number, over $6.5 billion with a B, not million, $6.5 billion annually to provide Medi-Cal to all undocumented immigrants in the state of California. That is a huge price to pay. And guess who's going to pay for that? You, me, the American worker, the American taxpayer, the American citizen. How are they going to afford all this, healthcare? How are we going to pay for that? You're going to see it everywhere. You're already experiencing it now, but you think it's bad now, it's only going to get worse. You're going to see an increase in state taxes. You're going to see an increase in the cost of living. And here's the saddest part of this. When these types of major policy changes happen, especially when we're talking about the economy and all of these government subsidized, the word subsidized, subsidy, what does that mean? That means something is supporting that. Something is making that possible for the government to give out this money. Well, who subsidizes the government? The taxpayer. The hard worker. And the saddest part of that is when this happens, the rich get richer. The people that we're electing and that we're putting in office who are living on taxpayer salaries, meaning their salaries are funded by your and my taxes, they get richer and we get poorer. Because now it's costing you more to live. So the idea that, first of all, this is a free benefit to undocumented immigrants. Baloney. It's not free. It's costing literally $6.5 billion a year. How are we going to pay for that? We're going to see an increase in taxes, increase in the cost of living, increase in food, increase in gas, increase in education. I mean, the ways that the government is going to extrapolate money from you is going to be endless. It gets worse, though. Number two, this is the other problem, or the next problem. Medi-Cal has limitations to eligibility for American citizens. Remember, these undocumented immigrants, they are getting, quote unquote, free access to Medi-Cal, a state government insurance. Yet Americans who live in the state of California and who are poor and cannot afford private insurance, they are limited. There's an eligibility requirement in order for them to receive access to the same crappy government insurance. Let me give you the statistics. In order to receive full health care benefits through Medi-Cal as an American citizen, you must earn 138% less than the federal poverty level. Let me break that down into US dollars for you. If you're a single person, if you make $18,755 per year, you qualify for Medi-Cal. You're considered at 138% of the federal poverty level if all you're making is $18,755. If you're a family of 5, which is the average household size in the state of California and in America, if you're a family of 5 or less, that number is $44,809 per year. If your family is earning $44,809 per year and you have 5 people in your household, you're considered at 138% of the federal poverty level. That means that you cannot afford to even be considered at the poverty level. You're exceeding the poverty level and you cannot afford any other type of insurance. So then California says, okay, we will give you full coverage through Medi-Cal. So in other words, you have to be poorer than the poorest people in the country in order to access this free medical benefit of California. But you and I both know that you cannot live off of $44,809 in this country, and especially in California, per year. There's no way. There's no way anybody could live off of that kind of salary. So what problem does this create? Americans who are considered living at or just above the poverty level, so if you make $44,810 per year, you don't qualify for Medi-Cal. You make $45,000 a year and you got a family, you're not qualifying for Medi-Cal. The people who live right at the poverty level or a little bit just above it, you don't qualify for government health insurance. You don't qualify for coverage from full coverage from the state of California. But at that same level of income, you can't afford private health care. You can't afford to pay for your own insurance. Let me give you some numbers. In the year of 2023, the average cost of private health care insurance in the United States is like this. If you were a single person, the average cost was $8,434 per year. That's how much it costs a single person to have private health care insurance. If you're a family of 5 or less, the average cost is $23,968 in the year of 2023 for private healthcare insurance. That's the cost of the premium. That means that's what it's costing you to stay covered with private healthcare. That doesn't include copays. That doesn't include medicines. That doesn't include your special referrals. That doesn't include dental. That doesn't include vision. We're talking strictly about going to the doctor or going to the hospital or going to urgent care. So let's just say, let's just do this math real quick in our heads. Let's do a little experiment. Let's say you're a family of 4 or a family of 5. You make $65,000 a year, which used to be considered a decent income. This is not that likely anymore in California because the cost of living is so high that usually parents both have to work. But for some people, it doesn't even make sense for a spouse or a second person to work because of the cost of childcare. So let's just say you make $65,000 a year. You decide, you know what, my wife's going to stay home. She's going to help take care of the kids, all of that, right? Do the math. You don't qualify for Medi-Cal because you're not considered at the lowest point of poverty. So to pay for your insurance alone, it's going to cost you $23,986 a year. It's almost $24,000 a year. That's going to leave you with about $41,000 per year of gross income, not net income. That's before you pay your taxes. $41,000 of gross income. That doesn't include federal taxes, state taxes, Social Security, and everything else that we're giving away to the government. Okay? Then you actually have to live a little bit, right? You have a family to feed. You got people to take care of. To feed a family of 5 on a decent budget, you're looking at $150 to $200 a week. And that is really skimping it in today's prices for groceries. So you're talking about feeding a family of 5. You're talking about $150 to $200 a week. That's $800 to $1,000 a month. And that's not even like living like kings. That's another $12,000 gone from your annual income. Not to mention the cost of rent. The cost of a mortgage in today's economy is skyrocketed. You can't even get a 2-bedroom apartment anymore for under $2,200, $2,500 here in California. I know people who are living in LA County, that are renting a 450 to 500 square foot apartment that are paying almost $2,000 a month. That's insane. Add on everything else that it costs to live. Gas, food, household expenses, clothing, school supplies. The list goes on and on. Before you know it, you're broke. You have nothing. You have nothing. That's what's wrong with this whole, free healthcare. Meanwhile, while you're over there broke, struggling to survive, working 2-3 jobs, while you're over there struggling to survive and take care of your family and feeding your kids beans and rice and struggling, you got illegal, undocumented immigrants who are crossing the border, coming into this country, and they're living off of your tax dollars. They're living off of you and I. And they're flooding into our country. They don't pay taxes. They don't pay into Social Security. They don't pay the state anything. The federal government gives them whatever they want, free college, right? Low-income housing, low-income subsidies, and all of these programs for them. And now, free healthcare. Yet you, the American, born here, working hard, making just a little bit more than the poverty level, you don't qualify for government assistance, for free, quote unquote, free medical care for you and your family. And meanwhile, taxes are getting higher. Gas is costing you more. It's costing more for groceries. It's costing more for everything. Behind on your bills, not able to pay. And look, I understand I'm not describing everyone. I'm not saying that every single person can't afford to pay their bills. I'm not saying that you can't afford to pay your bills. I'm describing, though, a large populace within this state and ultimately what these programs are doing to the American worker, to the American citizen. Do you see what's wrong with this? Do you see what's wrong with this? So what is the result? When we have this type of system in place, what is the result? Check out these stats. In 2023, 8% of all Californians were reported as not having insurance, as being uninsured, presumably because they didn't make enough money to pay for private insurance, private healthcare insurance. They can't afford $23,000 a year to pay for their family, but they also make too much money to qualify for free healthcare insurance from the government. 8% of those numbers, I want you to look at these, how these stats are broken down. 12% of those people were Latino. Latin Americans living here who can't afford to pay for private healthcare insurance, but also make too much for government healthcare. 4% of them were white. 6% were black, African Americans. 6% were Asian. Check this out. 7% of them were lawfully present immigrants in the United States, meaning they came here lawfully. They're immigrants. They're not citizens, but they're part of the American economic system. Here's the number. 27% of uninsured people last year in the state of California were undocumented immigrants. That is the largest populace of uninsured people in the state of California. Now, under this new law, that 27% has instant access to health care. While the rest of them, the Latinos, the whites, the blacks, the Asians, they're still sitting over there in the corner. These citizens who are a little bit above the poverty level, they're still sitting over there uninsured. Meanwhile, 27% of that group, which is undocumented immigrants, has instant access to health care. So while you and your babies are trying to survive, working your butt off to provide for you and your family, struggling in this economy, sacrificing the things that you want for the things that you need, struggling to barely keep your head above water in this economic climate, you can't see a doctor for 6-7 months because you're saving up money for your medicine, or you're saving up money to be able to afford to walk in and be a cash patient. These undocumented illegals who come across the border, guess what? They get to walk into the doctor today and get full coverage. Doesn't cost them a dime. Full coverage for their health care. Yet you and I, guess what? We're limited in our coverage. And by the way, we're footing the bill. $6.5 billion for these undocumented immigrants who are coming into our country illegally. Do you see the problem here? You see why there are people in politics who are fighting against this left radical movement who wants to make you poorer while they get richer and help the people who come here illegally. They care more about illegal people coming into this country than the citizens that are here. And there's another problem with this, by the way. This is the third and final problem that I'm going to point out today. And that is the quality of the healthcare. How this affects the quality of healthcare. Let me tell you this. The quality of healthcare will drastically decrease into something much less efficient and acceptable according to medical industry standards when you start to subsidize government insurance for millions, possibly millions, of undocumented immigrants. Some people think, oh, well, healthcare providers, they'll treat anyone, right? I mean, isn't it their duty? Don't they take an oath? Isn't it their moral obligation? Let me tell you, the answer is no. It's not a duty. It's not a moral obligation. It's a service. The healthcare industry is not a right to people. It's a service that's provided. Now, this is where I'm probably going to lose half of you because some people think healthcare is a right. I'm not saying, and let me be clear, I'm not saying that people should not have access to healthcare. That's not what I'm saying. What I'm saying is healthcare cannot nor should it be free for everyone. It's not a right. Your doctor is not required to treat you or to serve you with the services that he provided. Because guess what? Healthcare providers and healthcare institutions, they have rights too. They paid the price and sacrifice while the rest of us were doing whatever we were doing. They went to college for 12, 13, 14 years to learn how to become the doctors. They're the ones who went to school and sacrificed so that they can provide you with treatment and with a service. And by the way, that's why it's called healthcare services. The point I'm making is providing a service is not the same as someone's right to something. A service is something that people pay for, otherwise they wouldn't have it. What do you think would happen if you walk into a restaurant today and order some food, but let them know, oh, by the way, I don't have any money? Maybe you might get somebody nice that covers your meal, but most people are going to say, sorry, we can't offer you service. Go to a car wash. Try getting through the car wash without swiping your credit card first. Not going to happen. Why? They're providing you a service. Ask a random stranger to come watch your kids for 8 hours a day. Guess what? Not going to happen. Why? Because you're paying for a service. So why do we think that healthcare is something that everyone should have, or a large populace or undocumented illegal immigrants should have as a right? It's not a right. It's a service that's provided. And check this out. You say, well, what does that have to do with the quality of healthcare? I'm going to tell you. Medi-Cal, which is California's government insurance, it pays healthcare providers and institutions 70% of the rate that Medicare pays. And of that, it's about 50% less than what private insurance companies pay out to medical providers and medical institutions. In other words, the government is shortchanging medical practitioners and providers the full payments of their services. So the government doesn't care about the doctors and the nurses. The government doesn't care about medical providers. They're saying, hey, you're required to give your services and all of the costs that are associated with it. You're required to give that to these people who are here illegally, don't pay their taxes, are not contributing to the American economy. We want you to give that service to them for free. And we'll reimburse you about 50% of the actual cost of it. And you have to do it because it's the law. You see what's wrong with this? So what does that do? It increases the overall cost of healthcare for everyone. And it reduces the quality of the services that are provided. You don't believe me? Just think about it. Put on your thinking cap for just a minute. If you're providing, you become the doctor for a minute. You become the medical institution. You become a service provider. Some of you are business owners. You provide a service. Think about this. If you're providing a service to a large group of people and that group of people increased by 10% in 1 year, in other words, the amount of service you're providing to people has now increased by up to 10%, and you know that you're going to be getting paid less for it, for providing the same service to more people, what would you do? I'll tell you what I would do. I would increase the cost of my services. I would spend less time with those people because now, in order to make the same amount of money that I was making before, I'm going to have to see more people. I'm not going to have as much personal time with those people. I'm going to lose a personal touch that I can provide to you as a service provider because now, in order to make the same amount of money I was making before, I've got to see twice as many people in order to get paid. So I'm going to increase the cost for the people who are paying because the people who are freeloading, they're not actually paying, and its cost is making me lose money. So now the people who pay, guess what? You're going to have to pay more, and you don't get as much access to my services. The quality of the service that I'm providing is going to have to give a little bit in order for me to stay efficient and make money. So here's what government healthcare for the masses does, especially to those who don't contribute anything back into the society that they take from. It gives us a lesser quality of healthcare, longer wait times, more difficulty getting appointments, higher costs of medicine, higher copays, less healthcare workers because they can't afford to keep all those people, and overall reduced service. Do you see the problem with allowing 500,000 undocumented immigrants to have access to quote-unquote free healthcare? This is the problem with the politics in this country. This is the problem with these people in power. This is crazy. Right now, California has more than 14.7 million people on Medi-Cal. Now, look, I am not saying that American citizens who are living below the poverty level should not be given access to health care. I'm not saying that. I'm okay with that because they're paying into it, or they have paid into it, and they can't afford private insurance. But what I am saying is it's absolutely 100% wrong that these people from other countries who don't want to follow our immigration process, our naturalization process, just jump across the border. They have low-income housing. They don't pay taxes. They don't pay anything to the government, yet they have free medical care, free college, free this, free that. Everything's free for them, and the thing is, it's not even free. We're paying for it. Every time you buy groceries, that tiny little cart that you barely can get any food, it's costing you $250, or the gas pump at the gas pump, or everywhere that or when you look at your check and the government is taking more money out of your paycheck, guess what? You're paying for their health care. You're paying for that group of people. And our governor, he wants to add this as a quote-unquote benefit to illegal immigrants. And I want to go back to his statement because now that we said all that, let's read his statement. In California, we believe everyone, doesn't that mean the American citizen too, deserves access to quality? Really? Quality healthcare. What about the people who are uninsured because they can't afford to pay for private health care, but they also don't qualify for your program that you're now giving away to undocumented immigrants? Affordable health coverage, regardless, he says, regardless of their income. Oh, so now you don't even care about their, well, in that case, shoot. What about the people who are making 100 G's a year? They should be eligible too, right? Do you see what's wrong with this? Do you see what's wrong with our society? And you say, okay, well, Gabe, what do we do about it? You need to vote for change. You need to really think about who you're voting for, who you're putting into office. Who are we voting into office? And how that's going to affect us. And this is why you can't get your information off of TikTok reels and Instagram reels and little short clips. And, well, I just don't like, this person because of what he says or what he does. And, oh, he was mean on camera. Wah, get over it. Look at policy. Look at what they're actually saying and how it's going to affect you and your family. It's time to wake up, folks. It's time to vote for change. It's time to get these guys like Gavin Newsom and all these other people who they don't care about you out of office. They don't care about you. They don't care about your family. They don't care that you're struggling financially. They don't care that you're barely surviving. And let me tell you something. They're getting rich. Their kids are in private school. Their kids have access to the greatest health care. Their families have everything they need, and we're the ones paying for them too. They don't care about you. Instead, what they care about is getting richer, making you poorer, and helping the millions of people that are coming into this country illegally, instead of the American citizens who are already here and need help. That's what gets me so angry. You want to help people? Help your own people. And make these people come to this country the right way and be a contributor to the society. I'm not against helping those in need. I'm not against government help. I'm not against food stamps. I'm not against healthcare. I think if people are really struggling, let's help them. But my God, make sure we're helping our own people before we help these other people come into our country and not even contributing to our economy. Vote to change. Wake up. These are my opening thoughts today. I'd love to hear your reactions and your comments to this. Please leave us a comment or send me a DM. Let me know what you think. Should illegal immigrants be given access to free government insurance in the state of California? Leave your comments on the video below. These are my opening thoughts. Let's jump into our Monday motivation. All right, guys. So today is Monday. And of course, we cannot end a Mad Dad podcast episode without giving you some Monday motivation. And so today I want to talk to you about saying bye-bye to the excuses. Bye-bye to the excuses. We've been talking about this for the last 2 weeks, and we have dubbed the year of 2024 as the year of transformation. So whatever those goals are, you're striving for them. You're pushing for them. I've been very open with you all about my fitness journey, right? I'm happy to share with you, and I hope you can see it if you're watching, that I have been making amazing progress on my fitness journey to lose weight. In less than 17 days, I'm already down almost 12 pounds. And I've been going to the gym 4 days a week. I've been eating healthier. I've been cutting carbs, cutting sugar, and I'm really trying to make that difference. But let's be real. Let's be honest. Making that difference, making those changes, it's not easy. And last week we talked about the 40% rule and about how you have more in you, you have what it takes. But this week I want to specifically hone in on the excuses, the things that we say to ourselves or the circumstances that we allow to justify why we stop or why we fail to move forward or why we're not making the progress that we really want to make. And, I was thinking about this week, right? And I shared this with you guys. I've been getting up every day at 4 o'clock in the morning. And I've been doing this now for over 3 weeks. And I'm going to tell you, so far, it's still not easy. It's still not easy to wake up that early. It's not easy to go to bed early. I mean, I start getting tired sooner in the day because I'm up earlier. But what I'm saying is the mental battle, the mental fortitude that it takes to will my body to sit up in the morning at 4 o'clock and open my eyes and get out of bed, it's a lot. It's a lot of willpower that has to be continually encouraged throughout the day and throughout the week. And so waking up at 4 in the morning, that's not easy. It's not easy to make these changes. And so as I've been going through this journey, as I've been going through this process of transformation, I'll be honest and say that the excuses that we make for ourselves. Anytime that I'm trying to do something hard, anytime that I'm trying to do something that means anything, the excuses, it's like you don't even have to look for them. They just begin to pop up. And it could be anything. Oh, I can't go to the gym because, I have to submit this report tonight, for work. Or I can't go to the, I can't make better health choices because I got invited by my boss to go to lunch. I can't do this and, or I can't pray more and I can't read my Bible more because, in the mornings I have to drop the kids off before I go to work and I don't have enough time for that. I can't get out of bed in the morning because I'm sore from the gym yesterday. And so if I go work out now, I'm not going to be able to move. We will make whatever excuse and whatever justification that we need to make in order to excuse ourselves or justify the reason why we're not doing what we know we should be doing. At least that's what the weak man inside of you wants to do. That's what your flesh wants to do. The comfy, cozy part, the part that says, don't push me past that wall. The part that says, keep me the way that I am. And let me just say this. It's easy to be unhealthy in any aspect, physically, spiritually, emotionally. It's easier to be unhealthy than it is to be healthy. Because to be unhealthy costs you and requires nothing of you, except for laziness. It just requires for you to really do nothing. If you do nothing, that's easy. But to maintain your health, to build your health, to be the strongest version of yourself, the best version of yourself, to have the right mindset, the right attitude, the right heart, the right spirit, the right strength, that's going to cost you. It's going to be hard. It's going to take work. It's going to take consistency. And so what I want to encourage you today, as you're starting your week, today's Monday, you're getting ready to go to work. Maybe you're already there. You're starting your week, and it's a new week. It's a new opportunity. It's a new, for me, Monday is like the reset button. Monday is my biggest motivational day of the week, because you have Monday through Friday is when I work really hard, bust my butt, go to work, provide for my family, right? Have all of my responsibilities throughout the week. Saturday, Sunday, at least from work, is a break. It's a little bit of relaxation time, a little bit of family time, church, spiritual edification. And then boom, Monday morning comes and it's time to rock and roll. Let's go. It's Monday. It's the refresh button. It's my opportunity to do better this week than I did last week. And that's why I dropped these episodes, by the way, on Mondays. Because I feel that Monday is that time of the week where we just need to get reinvigorated with passion, where we need to get reinvigorated with energy, where we're getting the opportunity to try again. And so I want to encourage you, because today's Monday, you're getting ready for your week, you're going to work. Maybe you didn't meet all of your goals last week. Maybe you failed. Maybe you slept in one day. Whatever things you did in the past, or whatever failures you have, they're in the past. So leave them there. Now you have an opportunity to do better. Now you have an opportunity to wake up and say, this day is going to be better than yesterday. I'm going to reach my goals today. I'm going to make better decisions. I'm going to make healthier choices. I'm going to make better I'm going to plan better in order to be more effective towards reaching my goals this week. And so I want to encourage you, because we have to say bye to our excuse. We have to excuse our excuses. We have to say, bye-bye, get out of here. I'm not going to allow excuses to be present in my journey of transformation. There is no excuse. There is absolutely no excuse as to why you cannot become who you want to become. There's not one. Circumstances change? Yes. Schedules change? Yes. People change? Yes. Finances change? Yes. Relationships change? Yes. There's 1,000,001 things that change. But all you have to do, as our favorite Marine Corps dad would say, is adapt and overcome. The issue in life is not change. It's people's inability to adapt to change. That's people's problem. My dad would tell us all the time growing up, adapt and overcome. Rise above it. Rise above your excuse. Rise above your circumstance. Rise above the thing that's holding you back. Rise above the thing that other people are saying, oh, man, you shouldn't do that and you shouldn't do this because of all. No. Rise above it. Adapt and overcome. Make whatever adaptations you need to make in order to be effective. The point I'm making is this. Say goodbye to excuses, because that's all they are. They're excuses. At the end of the day, you're in the driver's seat. I'm in the driver's seat. We're responsible for the decisions that we make. And so you can't let circumstances, you can't let unexpected changes to your life or to your schedule, you can't let other people determine your path and your journey to transformation. You can't do it. You have to step up to the plate. You have to say goodbye to your excuses, and you have to be determined right here that you're going to make the changes that are necessary, that you're going to adapt, you're going to overcome. So here's the motivation moment for you today. You're getting ready for your week. Hopefully you've implemented some sort of plan. You have a schedule for the week. You know when you're going to go to the gym. You know what you're eating this week. You know when you're going to pray, when you're going to meditate, when you're going to read the Bible. You know, hopefully, if you're hearing me right now, you're like, man, I don't know any of that. You need to stop and you need to make a plan every single week. You know your family's calendar. You know when the kids are getting out of school. You know who's picking them up, who's dropping them off, where they're going. You know what responsibilities you have. Once you have your schedule and your plan, you stick to it. You don't make excuses. You make it happen. And if you have to make minor adjustments, because life happens and sometimes we have to adjust, don't make an excuse. Don't let that be the reason why you chose to make poor choices. Instead, say, you know what? I'm going to make the right choice. Okay, so I wasn't able to get up this morning at 4 o'clock and go to the gym because, whatever happened, I don't know, had a rough night with the kids. This hasn't happened, but I'm just giving you an example. And so, you know what? Instead of saying, well, I missed the gym today, do some exercises at home. Do some sit-ups, push-ups, crunches. Go for a walk. Go to the gym at night if you have to. Whatever. In other words, adapt and overcome. Say goodbye to the excuses. Because every time you excuse every time you pardon yourself and make a poor choice, all you're doing is pulling yourself further away from the transformation that you need to make. And here's the most beautiful part, and this is what I want to leave you with. The more you resist temptation, the more you fight the excuses, the more that you make the right choice, the easier it becomes to make the right choice. Remember, I'm not saying this from a place of perfection. I'm saying this from a place of experience. I'm going through the journey right now. I'll tell you this, it's still not easy to get up at 4 o'clock in the morning, but it's getting easier. My day at the gym today I did legs. Today was leg day. My legs are all wobbly and trembly and achy right now, right? And I'm embracing the pain. No pain, no gain, baby. Today was leg day. Guess what? Today's leg day was about 10 times easier than my first leg day. It was, because my body is getting conditioned to the resistance of those weights. My body's getting conditioned to the exercise that I'm putting it through. It's the same thing with your mind. The more you make the right choice, the easier making the right choice becomes. And your body gets conditioned. And then when you make a bad choice, there's a higher consequence now that you're paying. It's a higher price that you're paying. You're going to feel worse about it. And so you're going to be driven to start making the right choices. So my friends, say bye-bye to the excuses. Don't let any excuse hold you back from becoming who you were called to be. Hey everybody, thank you so much for tuning in today. This is all that we have for you. We hope you enjoyed today's content. Please leave us a comment and let us know your thoughts on today's episode, and we would love to hear from you. If you haven't already, hit that like and subscribe button and share this with a friend. We also want to invite you to follow us on Instagram at MadDadPodcast. Wherever you're at, we pray that you stay blessed and that you have a wonderful week. Stay mad, stay motivated. We'll see you next Monday. This has been the Mad Dad Podcast.